What is forced vital capacity, FVC, in asthma? Imagine trying to blow out all the air in your lungs in one big, forceful breath. That's what measuring forced vital capacity is all about. It's a key part of understanding how well your lungs are working. Using a device called a spirometer, your doctor can see how much air you can push out after taking the deepest breath possible. This test is simple but very important for people with asthma. It helps show how much your airways might be narrowing, or if air is getting trapped in your lungs. In asthma, the airways tend to tighten and become inflamed, making it harder to breathe. When your doctor measures FVC, they are checking the maximum amount of air you can exhale forcefully after a deep inhale. If your FVC is normal, it usually means your lung volume is okay. But if it's lower than expected, it could mean there is some airway blockage or air trapping happening. Sometimes, in severe asthma, the lungs become less flexible, which can reduce the FVC reading. FVC is often used alongside other measurements like the forced expiratory volume in 1 second, or FEV1. The ratio of FEV1 to FVC helps doctors see if there is an obstructive problem like asthma. If the ratio is low, it indicates airflow obstruction. But FVC itself might stay normal unless the air trapping is severe. When the airways are inflamed or narrowed, the FVC can stay the same or only slightly decrease. Monitoring FVC over time gives doctors a good idea of how well your lungs are functioning. If your FVC drops, it might mean your asthma is getting worse or that there is more airway remodeling. It can also help tell if your treatment is working. For example, if you take a bronchodilator, a quick increase in FVC shows your airways are responding well. Measuring FVC during a spirometry test is quick and easy. It helps doctors see how much air you can exhale after a deep breath. This information guides treatment decisions and helps track your asthma control. It can also help differentiate asthma from other lung conditions like chronic obstructive pulmonary disease or restrictive lung diseases. In summary, forced vital capacity in asthma is a measurement of the maximum air you can force out after a full breath in. It shows how open your airways are and if air is getting trapped in your lungs. Regular testing helps manage your asthma better by showing how your lungs respond to treatment and how your condition changes over time.